Should I start?
Hmm.
वेलकम, नमस्ते।
एक बंदा भी वॉच कर रहा है, पहले ऐसे ही हेलो है।
हेलो, we just wait for like 2 to 3 seconds more. Okay, welcome, namaste. I'm Dietitian Rupali. I take this opportunity to thank the esteemed panel for giving me this opportunity to share my expertise regarding autism with you all. I would like to introduce myself as a dietitian, as a nutritionist, as a counselor with a qualified experience of 7 years. My vision is to transform lives with focus on nutrition, good health and positive mind. Autism as topic that is very close to my heart as I have treated and counseled like a number of parents. I would like to talk to you wonderful parents of children on the autism spectrum on this special webinar, the role of nutrition for children on autism spectrum. I, Rupali Gupta, a nutritionist with a special interest on looking after the dietary requirement of special need children. As parent of children on spectrum, I'm sure you have gone from pillar to post to doctors, therapists and try to do everything you can help your lovely and wonderful children. And I'm sure you are doing all the rehabilitation advice. But despite of all the treatment, some of the symptoms our children persist. And autism is one condition where the role of diet is very important. I want to make sure that in autism, diet and in nutrition is not just that, it is actually a treatment. Yes, you are right. It is actually a treatment in the children on spectrum. If we give a proper and nutritious, appropriate diet, it leads to improvement in the symptoms. This is a treatment form which is in our hand. See, in our hand, in our kitchen. This we decide what to give to our child, what he is liking, but in the parameters. Parameters, what do you give your child on daily basis? What do you give your child for breakfast, lunch, dinner? Then how you handle the child if child doesn't eat, and how you handle the child if it demands for the things that should not given. Here the diet, the role comes. You have to fix everything. Each and every minute it will be scheduled. We are looking all the aspects. Also before beginning, I would like to say that in my years of practice, I have developed a tremendous respect record for the parents, in particular to mothers of the child on the autism spectrum. The admire, the courage of you all have been looking after very, very difficult requirement of bringing up these children on day-to-day basis. The rest of the world doesn't understand autism. Yes, it is basically it's a hidden disability. Hidden disability because it like the child appears just the normal child. So the world will not understand what it takes to you a single day of your life, having a behavior issues, handling the lack of understanding. These children have lack of communication and just have to go everything looking of these children is very demanding. And I have higher respect in regard for that. And if there is anything little that can I do through my professional ability to able to help special needs children and for their family, it's my privilege and honor. From this, I will start my main parts of the talk. So, here in my theory is autism. A stands for an, ultimate life. In tree is our family tree. Family tree, we have an ultimate child, ultimate life in tree, inviting strong mom and dad, and ultimate life. So, parents, I want to give you a new autism definition. Just have in your mind an ultimate life in my tree, inviting strong mom and dad. A normal parents can handle their child very easily. You parents are the real diamond of the world, and you have the diamonds in your arms, whom you all are growing your child with all your time, all your effort, everything you are giving to your child. So hats off to all the parents with the special child. So here is what is diet therapy. Diet therapy or dietary intervention is the treatment in which a dietitian will add, modify or eliminate some food from your child's diet so as to make it nutrition dense and reduce any behavior issues associated with diet. She will also guide you with the technique if your child a picky eater, if there is a behavior issue, if there is a gastric issue, if there is constipation, each and every parameters will be controlled by the diet. What does it consist of? The dietary intervention will be based on all the information about your child eating habit gathered by dietitian. It consists of following age, height, weight, BMI, any religious food restrictions, how many times does the child eat in a day, brief description of all the meals consumed by the child, any previous history of food allergies, any dietary interventions are done earlier, food causes any discomfort of child likes and dislikes. That's a major issue parents will face. Parents says my child like to eat all the time carbs and carbs. But this is not the right treatment for the special children. We have to cut short, but how to cut short the carbs in their diet? This will I teach you. Activity level. The hyperactivity makes the child more aggressive. Once we give to the carb diet, the child become more and more hyperactivity. Just like if we have a glass of glucose, if my son comes to house after taking just a 100-meter race, and what I just give him a glass of glucose, it gives an instant energy. He becomes hyperactive just like a superman. So if we go with the carbs, this same works with the special children. So if we give a simple carb, this will really hit their hyperactivity. Water intake. Sometimes what happens, parents think over this, if we give a more of water intake, if we increase the water intake, he must spoil his or her clothes, or there is some issues for the toilet. So no worries over this. We have to watch water intake in the daily basis. Bowel habit. If water intake is good, if fibrous diet is there, no carbs is there, bowel movement will be perfectly alright. Table manners. This is for all the kids. I'm here for just telling you about the autism, but this is my personal perception, that a normal child is same as the autistic child. It is not like that. There is no difference. For the normal child, we train them for the toiletry. We'll just check the bowel habits. We just check their all the activities. It is going on and off. But there is a little different parameters. So in this for the special child, there is a little requirement for the intolerance test. But nowadays, the people are, it is if we are just differentiate the child, the normal and the autistic. But nowadays the people are shifted towards the gluten-free food. It is not like that. Now they are shifted to the vegan diet. So now it is like GFCF diet, gluten-free, casein-free. Everyone is like to shifting. Lots and children and parents comes to me, ma'am, my kid is having a bowel movement, they are suffering from IBS. So it's all, we cut short the gluten. We cut short the gluten because gluten need too much of activity, just like a farmer. It is for 10 hours activity, 12 hours activity. The protein, the gluten is like, it requires lots and lots of effort to catabolize. So dietitian will plan a diet based on all the above parameter. So next to the food is essential because it contains substances which perform important function in our body. These essential substances contributed by food, that is called nutrient. Nutrient we classify into 6 major parts. That is carbohydrate, protein, fats, minerals, vitamins and minerals. This we all know. But what we forgot? Water and roughage. And that is the most important thing. Protein, it is in the stored form in our bones. Carbohydrate gives us energy. Fats gives us energy. Vitamin and minerals, it is work like coenzymes. Water and roughage, it's all forgotten. It is very important in the diet of everyone. Everyone diets, water and roughage is important. If the nutrients are not present in our food, what happens? Like it is not in the sufficient amount. What the result? The end result is ill health, constipation, gut issues, mood swings, lots of, if we are standing in the umbrella, if we are not having the nutrients, we catch lots and lots of diseases, deficiencies. So in special child cases, we have to reduce or say no to carbs. That's really very important. I'll just give you a simple example. We have like 3 kgs of gut bacteria inside us. If we're having a glass of aerated drink, it like in a second it destroys 2 kgs of gut bacteria in an instant phase. And if another hand, if we talk of this, it will take a day or a couple of days to make that, to cope up with the 3 kgs of gut bacteria. And this is quite difficult. And this happens only when we include all the roughage in our diet. We just eliminate the carbs, then only it's happened. Happens with a glass of aerated drink. It is just a small example I am giving you, and it is very simple for everyone. That if child is on a cranky mood, or he said, no, I don't want to eat from past few hours, he or she is not having anything, the parents is on the like, oh my God, have something. Please try to avoid all the junk, all the artificial sweeteners, the chips. It's very simple to avoid. If we just make our kitchen healthy. There is a special child. In one of my treatment, I first counsel the parents, because there is no need to counsel the child. I counsel the parents, you have to stick on your diet. Rather you switch to your son or daughter's diet. You have to just remove all the aerated drinks, all the preservative things, all the ketchups and everything from your house. Make it your environment, your dining table, your fridge, your refrigerator, your kitchen, your wardrobes. Everything will be on the safer side, without any preservatives, without anything which can attract your child. So, there is something like for the carbs, if we go, simple sugar can be hazardous to those with autism. There I force you I explain you everything over the carbs because it actually hyperactive your child. The increase the energy level on the temporary basis will be attributed by hyperactive behavior intermittently. Sugar substitutes. Don't go for sugar-free pills, sugar-free tablets. Go for natural sugars. It's just like jaggery, or you can boil like dates in the camel milk, cow milk. So, and second thing, it's really a good source of iron. Instead of having fresh juice, go for a fresh fruits. It is in, if your child is not chewing, it is like he is on the drooling side, so just give him or her the stewed apple, mashed banana, grated pear, add fruits in the soups and gravies. Food help in controlling hyperactivity of the child. Infant. This is a simple theory. When a child give a birth, he is in the womb of a mother for 9 months. Once he or she is out, at that time infants are born as univorous. We heard of carnivorous, we heard of omnivorous, we heard of herbivorous. But the child, the time, the infant born as a univorous, that is, they required a single food source, and that is milk, the human milk, the mother milk, which contain an adequate amount of nutrition. In our normal cow milk, buffalo milk, any of the milk doesn't contain iron, vitamin C, vitamin D. Nowadays, fortified milks are coming out in the market. The government fortify all the milk, all the products to make all these nutrients together. But see, the mother milk have each and every nutrient, a single minute nutrient in the milk, in her milk. So in order to continue normal growth and development beyond the nursing period, their parents must help them make the transition from dependent to independent. Here our work comes. Once the child comes to dependent to independent, self-feeding, learn to accept and enjoy the varied omnivorous diet. At that time, we have to fix every minute, every meal, everything on the time. So, here is at the time, child shift from single to multiple food sources, increase opportunity of self-regulation of food intake, new social context for eating involving peer and adult caretakers. Time management. So, here we have some time management. Human infant are neophobic. So, in this I just want to tell you, don't compare your child with a special child. In my introduction, I say it is difficult to recognize whether the child is autistic or normal. Once I see the behavior, then only we judge there is something wrong in the child. There is something is missing in the child. So, take your child as a normal child. Don't over expect to just add in your life. Try to move in your children's life. There is something different. If I am speaking, your child is listening to me. Maybe he doesn't listen to me. He listens the clock movement. He listens the sound of the fan, and it is really so irritating. Think over this. How is it like possible to live life with these sounds? So try to help their kid. Never expect that your child would live as life as you are living. Try to live their life. So, for living the life, time management is very important. Fix each and every time of your child it really helps in the calories and like works like a magic. So here it comes to the keto diet or said GFCF diet, gluten-free, casein-free. Gluten basically a protein which is like very difficult to digest and present in our all the wheat products. It's all like all the wheat products like barley, rye or the normal flour, semolina, refined flour. So GFCF diet, keto diet, or we said high protein diet. The keto diet is low carb, moderate protein and with a very high fat. That has emerged as potential treatment for autism spectrum disorder. It helps in improving bloating, which is the major issue with the parents. They always complain for that, like my child is suffering from bloating because they are giving gluten to him. Gluten is like a thing which the stomach doesn't recognize. It is something like foreign invader comes to our stomach and it's like what to do and HCl is there, the acid is in the stomach. It just like say just go to the intestine and intestine doesn't know, while intestine will recognize when the food become in the catalytic form. So it helps in improving bloating, diarrhea and discomfort that occur in autism children. It has not shown too effective impact behavior in controlled clinical studies. The thing is this, we have to be very patient and I really respect and regard the parents. They are really so, they handle so patiently their child, they involve in their life, they live with them. That is the main thing you have to do. So keto diet will help the child who suffer from autism and epilepsy. Sometimes this happens. Seizures are there. At that time we have to cut short all the carbs from the diet. And these all are carbs like aerated drinks and any kind of like, see, the simple carb, breads, aerated drinks, fries, or your pastries, your bakery items, chocolates, all the candies. So please avoid this and go for a high protein diet. High protein diet, almonds, egg, chicken, all the pulses, soya bean. You have to incorporate all these diets. So next nutrient, the most important nutrient, healthy fat. Fats grease the body. It helps to relieve the constipation like fish oil, cod liver oil, coconut oil, avocado oil, almond oil, MCTs, extra virgin and many more. Too many fat cause loose stool. So be vigilant. What happens whenever I give the suggestion to the parents like go for a good sources of fat, they incorporate like 3 to 4 teaspoons in a day. So each and everything in a balanced form. Don't give extra to like this will relieve to my kids for the constipation, so we'll include like 3 to 4 times more of their dietary requirement. So too many fats cause loose stools. So be vigilant and talk to your dietitian about which oil and how much of each would be suitable for child. Sometimes histamine is an enzyme which irritates, which give a lot of bloating, lots of diarrhea, and this will be diagnosed through the your allergy test. So always see what your child gut friendly. We'll add fermented food. Fermented food is like it is. Lastly, I talk about like for the gut bacteria. Fermented food helps to make our gut flora. It is like very easy for every child. Fermented food have give live bacteria in them and can help with form bowel movement. Be careful with fermented food if your child is sensitive. Fermented food help like this. I just give you a simple story. If we are standing on the border of India and we are on the war side. We have army of like 100 and on the other side the army of 200. So what will the conclusion? We'll fight, but still we start the fight, but we just convey the message for the more forces. This is same with the gut bacteria. If we help our gut through fermented dosas, kimchi, or if we go for the Indians is kanji, yogurt, all the xylem, if we incorporate, it works like a soldiers on the border. We just gather in hours, we gather the soldier of like the capacity is like 500. 200 to 500 if we reach, if we just cover this crowd, we need to incorporate fermented food in our diet. So, next nutrients we go to vitamin. This is really very important. Vitamin plays a major role. Vitamin A, vitamin D, B12, calcium and all the vitamins. This is like, I just majorly point out with the vitamin A, D, B12 and calcium. Vitamin D. Vitamin D, the first thing is vitamin D is a sunshine vitamin. Vitamin D helps in forming strengthened neural connection by affecting the neurotransmitter. And vitamin D and vitamin C are interconnected. If our vitamin D is good, calcium automatically it forms calcium. Because what happens, the absorption will be more. If we just taking the vitamin D and there is like deficiency of calcium, no use of having vitamin D. It easily out from the child's stool or from the urine. So it's a sunshine vitamin. Try to just move for 10 to 15 minutes in a day. Just give a sun bath to the child. This will help for the neurotransmitter and neural connection and helps in the growth of the autistic special child and for the normal too. So here we are for the vitamin B6. Vitamin B6 is found typical multivitamin but can also be separated supplement. The vitamin play a role in dopamine. This is basically a happy hormone which regulate with help to the mood enhancement. And this is really required. If dopamine goes on like peak, everything will be fine. So next we come to the magnesium. Magnesium is also a vital nutrient. It ensures proper functioning of the brain and muscle cells. Magnesium is found in food items such as seed, nuts, whole grain and leafy vegetable. Seeds, we go for a pumpkin, we go for a flax, chia, lots of seeds are there, hemp seeds. Vitamin 6 and magnesium are usually given together. Same for the absorption. If we give vitamin B6 and magnesium together, this will work like it directly goes to the cell and start working. Same with the iron. If I give iron with the vitamin C, it works like magic. So, as vitamin B6 can sometimes cause unpleasant symptoms, including upset stomach, and the magnesium appear to counteract this. So, whole soul theory is this: vitamin A, vitamin D, vitamin B12, calcium, magnesium, they work together. So, any of the deficiency leads to hyperactivity, leads to diarrhea, leads to dizziness, leads to any kind of seizure. So we have to watch vitamin and minerals very carefully in the diet of the children. Melatonin. Melatonin is a hormone produced by the body. It is not like melatonin, dopamine or everything. This we have a factory. We inside our body there is a pharmaceutical factory. So melatonin is a hormone produced by the body. It helps in regulating our sleep, wake cycle. Other children with the autism have difficulty with sleep. For the melatonin can be helpful by doing chanting. We move to the chanting. This really a mind relaxer. Food and meditation work together. Start your day with chanting. I really request to the parents, do chanting. No matter. Don't think of this ki my son is like my daughter, my son is not responding. He or she is not listening what I am saying. So why do I do this chanting? It is like I request to the parents to do chanting in the morning in front of your child. No matters if child is responding or not. This directly go to the heart. This directly go to their mind. They repair their system. They refresh our mind and soul. Once there is a word for the soul, it means everything will be sought out. So do Om chanting. This work like magic in both the cases, for the parents, for the child, for the family, for the aura, everything. And it is really very simple. We start with, I do a Om chanting. It depends what kind of chanting you people follow. So do whatsoever you are doing. So start Om chanting doing like this. Om. Like this, you can create an aura on your surroundings. So Om chanting, any kind of Buddhist chanting, whatsoever is chanting, meditation, it really helps to make serotonin, dopamine, melatonin, everything is in our hand. But the thing is, we have to just follow the path. Omegas, very essential thing which we have to add in your diet. Omega 3, 6, 9. This is omega 3, basically a fatty acid, are important from brain and eye development. Sometimes what happens, lots of clients comes to me, ma'am, there is no eye contact with the child. One of the patient comes to me and the child is sitting in front of me with a very normal kid. There is speech, there is everything in like that case. But when I ask anything to the child, he is like seeing here and there is no reply, nothing. So vitamin A plays a very important role. But vitamin A and omega, if they combines, this will work like beyond the earth. So omega 3 fatty acids are important for brain and eye development in human, and both in special child and the normal child. Two types of omegas are found in seafood, while the third type is found in plants and oil. Methyl B12. So methyl B12, it helps in enhancing the functioning of the nervous system and body. Vitamin C. Here we come. As I just told you in my introduction that we just avoid the colors and we avoid the sugar, the artificial sugars and everything. Here come. If we go with the dates, we have to incorporate vitamin C because dates contain iron. And iron's absorption is only with the vitamin C. Vitamin C supports the production of neurotransmitter and help protect the body against the radicals. Radicals, this is again the foreign invaders which come inside, and WBC doesn't recognize what is this. So they become mad and they said what it comes inside us. Vitamin C is also necessary for the healthy immune system. This is what we are working for, the immune. This past COVID just teach us everything about the immunity, immune system. If we are good enough with the immunity, we fight with the COVID. We fight with any of the disease. So we have to work on our immune system. Probiotics. Many children with autism are prone to GI. GI is basically a gastrointestinal issues such as abdominal pain, constipation and diarrhea, which causes the symptoms of ASD are inflammation and abnormal microbes found in the digestive tract. Detailed research on the probable cause is needed. However, it is well established that gastrointestinal problems commonly occur in children with ASD. Gut bacteria found with the GI tract, and this will be work as messenger which sends signals, communicates with different parts of the body, including the brain. This is the major thing we have to work on this. Hence, it is thought that an imbalance in bacteria in the gut can have an effect on mood, attention, stress and sleep. See, with the help of probiotic, we can work on attention, stress, sleep, mood and everything. For the probiotics, I give you some examples. That is like if we are include ragi in the diet, if we include xylem like isabol, yakult or Greek yogurt, any kind of like idlis, dosas, pancakes, but you have to avoid all the sodas and sodium bicarbonate in the food. It must be self-fermented. Go for a kimchi salad. That will work like marvelous to the diet for the gut bacteria. So, next we have camel milk. This from my side as a nutritionist, counselor and dietitian Rupali, I highly recommend camel milk because with lots and lots of things we have to say about camel, but in cut short I need to tell this is high in antioxidant. It helps to fight lots and lots of bacteria, the foreign invaders which comes inside our gut, which comes inside our cells, which comes inside our GI tract, in esophagus, in colon, everywhere. It is not lactose free, but a very minimal of lactose in this milk. The camel milk is high in antioxidant which help to prevent damage of your cells. Of the basically a autistic child, this cell, it's high in several vitamins and minerals including vitamin A and B. Camel milk could play important role in decreasing oxidation stress by alteration of antioxidant enzymes and non-enzymatic antioxidant molecule level, as well as the improvement of autistic behavior as demonstrated by the improved childhood autism rating scale. You can add rolled oats in the camel milk. You can make starter like yogurt with the camel milk. You can add if you want to make a curry of tofu. We'll go with the tofu because we are avoiding all the milk and milk product. So we take a plant-based product, so that is tofu. If we make a tomato puree with adding almond milk, will give a very beautiful texture and it tastes like deliciously. Your child will enjoy it. So make everything very colorful and interesting to eat. Never ever thought of that ki it's okay if I make like shahi paneer or any paneer or any dish from the tofu. It is just like on the blended form. Make it, I'm not saying that make it spicy, that make it like over oily or anything which is like disturb the gut. So always make it tastier and healthier. Go for a rainbow diet. Make lots and lots of colors. Just add lots of colors in your child diet. give you a little brief over this. For the breakfast, we can go for a coconut yogurt, coconut milk, or we go for almond, soy milk, any kind of plant-based milk. Egg with gluten-free whole grain loaf, or nowadays keto breads are available. Oats breads are available. The many kinds of loaves are available which are gluten-free. You go for a nachos, that really helps because it is corn-based. You have to check whether it is like of gluten or without gluten. Avocado dip will work. Hummus with the raw grated cucumber, carrot you can give. Coconut with granula, it must be gluten-free. Granula contain all the vitamins and minerals in itself. Camel milk, I already told you about the camel milk. Camel milk is high antioxidant, must incorporate the diet of the child. Pulses, make pancakes, soak overnight, and just add a little bit of coconut yogurt in that, make it fermented, leave it for 2 to 3 hours, make it self-fermented. It works like a probiotic. Add flax seeds. Basic flax seeds, it's high in omega-3 and works like a roughish too. This will help as a cleansing agent in the gut. So add flax seeds in the diet. You can add in the dough, in the ragi dough, ragi batter. Make a ragi batter, add half teaspoon of roasted and grinded flax seeds. That will work like a cleanser in the body. For the lunch, we go for a nachos with baked beans. Make a presentable plate, put it nachos, put baked beans with the grated vegetables. Try to avoid cheese. Porridge, multigrain porridge, again if it is like difficulty in chewing, make it in a puree form. Add each and every vegetable in the porridge. Oats chila, oats pancake if we say, with all the veggies. If you want to add avocado, give the oats chila, oats pancake with the avocado dip. Glucamole, salmon, if you are non-vegetarian, go for a fish, but always avoid a big fish. Always choose a small fishes because big fish have lots and lots of bacteria in them, which will sometimes give diarrhea, irritate bowels, and leads to dizziness and hyperactivity. So avoid big fishes. Always go for a small fishes. Boiled lentils with spinach tortilla you can make with your own. Make a spinach puree, make a dough in a gram flour, make a dough in a ragi flour, anything whatsoever is comfortable for your child. But make a puree of spinach, make a puree of beetroot, make a puree of any of the vegetable. Make a puree of bottle gourd, make a puree of zucchini, or you can just cut or grate the zucchini and just add in the lentils. Khichdi, again add lots and lots of vegetables because it works like a fiber. Dinner, go for a chicken soup. Dinner and lunch we can combine. Either nachos, either chicken soup, again the fish, idli sambar or dosas or upma but self-fermented. Try to avoid sodium bicarbonate to add in your meals. Green vegetable with rice. Rice must be a smaller. Try to avoid basmati rice because it is really difficult to digest basmati rice. Rice noodles, again once you boil the noodles, just mash it with your hands and add lots of vegetable, buckwheat chapati, buckwheat pancake with Greek yogurt or any vegetable whatsoever your child will like. For the calcium we go for a sago. You will make a sago potato patty. Again add flax seeds in it, yogurt, grated fruits. Just take a bowl of yogurt, add grated fruit, chia seeds and make a chia pudding. Spinach beetroot pancake will work a lot. Pumpkin rolls, pumpkin soup. So beetroot raita. Basically beetroot raita it's a good combination of fiber and calcium. Spinach chapati. So this all for the roughage, the calcium. I almost cover all the nutrients. We talked about the carbohydrate, fat, proteins, vitamin, minerals, waters and roughage. Now, the parents. This is really important to be like fixed with your child. Sit together at a table for the meal. Never shows that your child is on a special child, so treat your child separately. Let the child comfortable with the family. It will take time and it is really a little hard to do. But it is important for a family to eat together. It gives environmental cue for a child that it is a meal time. And fix the time. If you are giving breakfast at 8, next day it must be at 8. If you are giving lunch at 1:30, next day it must be on 1:30. Don't change, because our gut, we have an alarm clock inside us. It gives environmental cue for a child, that is a meal time. Eating together help your child learn through imitation. This is the thing. Eating together, it gives you a bonding, it gives you a love, it gives you like affection with each other. So eating together help your child learn through imitation. And more of the parents, I think they are thinking of this, she comes over here for telling about the diet, and she is telling us about the manners, she is telling about the environment, she is telling about the chanting. It's all together work. Diet is incomplete with all these things. Nothing like diet is nothing if we are not following each and everything. The major role is of diet is of 70%, but rest of the 30%, all this like sitting together, moving to the park, watching TV, like go for a picnic together, this all works together, then only diet will work. So avoid mealtime distraction and clutter. Avoid giving mobile or watching TV. This is the most common phenomena is going on these days. It's very simple to give like mobile phone to the kids and the kid is happy and the kid doesn't know what he or she is eating. It's not like that. The child must eat from their senses. This is the important thing, which we are lacking. Not for the special child, for everyone. Nowadays, the people give the excuse, it's very simple, ma'am, kids born with the mobile phone. They are of the new generation, they are not of the new generation. We are showing the new generation. That's why all the diseases, all the disorders will be occurring. So, try to avoid giving mobile or watching TV at meal time. Place of meal should be clean and clutter free. This is again very important. If your child is doing it makes the table messy, it's okay. But always tell him, always teach your child that don't make messy of your food in a day, maybe in like couple of days, couple of weeks, couple of months, couple of years. One day the child will understand this is not a good thing. It is better to sit at one place for all meals because it fits in the child mind. It's in the brain. It's come over this. This is my place. This is my eating place. We never give the food in the washroom on the shit area. Is it? They think over this. Is it possible? If I say go to the washroom and just sit on the WBC and have your meal, not possible. Once you listen all this thing, you say, oh, what she is saying? Is she gone mad? So why we don't think of this? Why we never think of this? Like we have to fix. Like if I talk about the house, there is one assigned area, dining table. For why? Why the all the architect interiors they put a dining table in the house, right? This is not for the showpiece. This is for actually a meeting area. And this is really, we all are lacking. All we are lacking the meeting area, the tea time. What is the tea time? In the past of ages, all the ladies sit together in the evening, they had a cup of tea with a snack and they just do chit chat all of the day for the husband, for the kids, for everyone, in-laws, for everyone. So everything will be out from their head, everything will be out from their heart. They are, next moment, they all are clean and clear. They just planning for the next day. So please, I request you all, it is better to sit at one place together for all the meals. If you are working, try to have 1 or 2 meals. Try to have breakfast with your child. If you are moving at 8 o'clock, fix the time for the 7:30 in the morning, and you are back at 8 o'clock, fix the time for the 8:15. This will work. Lunchtime, your child must be knowing that I am doing with my nanny or somebody, the same people in the house. So, limit fluid intake, avoid giving excessive fluid like juice, milk before meal time. Because what happens, the stomach knows. There is a hormone, we said ki now I am full. Then the child start doing tantrums. And the parent says, oh my God, my kid is not eating anything. The ones I counsel them, they said, ma'am, yes, it is like 1 liter of milk in a day. 4 times we just give a glass of milk and it is very easy to, and on the another hand, lots and lots of vitamin and mineral deficiency occurs. So try to avoid giving milk before meals. So here comes with the most important question which will be asked from my clients or the parents. They ask for the constipation. I think each and every parent whose child is autistic suffer from this constipation. So constipation, I already told you about the constipation. Add fibers in the diet. Increase the amount of dietary fiber in the diet of your child, like fresh fruits, probiotics, prebiotic vegetables. Avoid food high in sugar, especially aerated drinks. Please don't give them aerated drinks. It is not the solution. It worsens the life. It doesn't help your child to be like, it's not like this, your child is fulfilling with the aerated thing. It hyperactive your child. Everything will be washed from the body, all the vitamin and minerals. Fluid will help soften the stool. Sometimes what happens, there is a hard stool. So if we are like on the appropriate level of fluids, the stool will be softened. And make it easier to pass, like apple stew, mashed potatoes. They are natural laxatives. If your child is on a diarrhea, loosey, spoil their clothes, just give them apple stew. Apple stew works like a medicine. If you give thrice a day apple stew, diarrhea will automatically, like the stool, it is in the normal formation. Apply neem oil in the navel of the child before bed. It works as an antiseptic. Signs of constipation, trouble sleep, aggravation and self-injuries behavior. Loose bowel movement, the appearance of the stool, toe walking. This is the major thing. What the child start doing, start walking on the toes. This is the major thing when the child is feeling constipated. And it is like very difficult for the child. He said, I'm not pooping. It's difficult for me. What to do? So that time the signs will indicate, just like the weaning time. If the infant is of 6 to 8 months, he or she just talk in the signs. This is the thing. So to start in constipation, the child start walking on the toe, stinky poop, because there is a lots of material. It is in the rectum and anus. And whenever the poo comes, it comes with that only the hardest, all the fiber just changes to feces. So that why the reason is stinky poo, bedwetting, because the self-control will be out of the control. Night walking because of pain, and we thought child is in a pain, child is in a hyperactivity, maybe something is there, but we never ever think of it is all root cause of constipation if child is like night walking because of pain. So these are some Bristol stool chart. This is like if your child is doing like this, like excrete out of feces, this is severe constipation. Mild constipation, lumpy and sausage like. It is just like a sausage. It means your child is on a mild constipation. Normal, it is on the binded form, a sausage shape with crack in the surface. Crack is really very important because our peristaltic movement is there. Peristaltic is like it moves from the large intestine like this. So this will form like this. So a sausage shape with the cracks in the surface. So there is a cracks in the surface. Type 4 normal, like a smooth soft sausage on snake. It is smooth but just like a snake scales. Lacking fiber. This is the thing. Soft blobs with clear cut edges. Type 6 mild diarrhea, mushy, consistency with ragged edges. Severe diarrhea is this liquid consistency with no solid pieces. At this time, boiled apple, stewed apple will work like a magic. But you have to see whether your child is allergic to apple or not. I have one client, Vihan. One of our autistic clients, namely Vihan, suffered from constipation, mood swing, indigestion. We help him through proper diet, where we focus on blood flora. I add lots and lots of fiber like ragi and keep watching his diet, whether he is taking or not. If he is not taking, his mother always complained for that, ma'am, he is not eating, what to do now? So we'll make a ragi malt, we make a purees. And in the span of 3 months, his gut start working properly with a normal stool, with a proper nutritious diet and a counseling. So next we have some questions. Can my child be constipated even though they have daily bowel movement? Yes. In fact, many parents of kids with autism do not even know their child is constipated because the child has daily bowel movement. The child is simply not exerting enough stool. The stool texture should be formed, yet soft and easy to pass. Frequency of occurrence. Bowel movement is occur on daily basis. The amount of stool explained. Doctor suggests 8 to 10 inches per day. So that is important. So next is our conclusion. Try to cut short or eliminate gluten, dairy, soy, artificial ingredients and limit sugar. That is really very important. The first conclusion is like the life of your child. Eliminate gluten, dairy, soy, artificial ingredients and limit sugar. Recognize food in your child diet that are constipating. We have to see what the food gives more constipation to your child. And sometimes just eliminate it or dairy or anything. Sometimes this happens, dairy will work as a normal stool formation. So just watch what all the things are not suiting to your child. Eliminating all dairy from the diet can make a big difference. Lots of whole food, fruits and vegetables are helpful. If that doesn't help, investigate other options like the specific GFCF diet, keto diet plan from professional. Thank you so much. I want to thank everyone for taking out time and being patient with it. I hope my session and knowledge shared will be beneficial to all the parents. I thank you again. Stay healthy, stay motivated, stay energetic with pure soul. Jai Hind. Any of the parents want to ask any of the question or queries there, you are welcome to ask me. My child, one of the question from, my child is a picky eater which make it difficult for me to stick to a good diet and nutritious food. Yes, it's a very good question. Okay, the thing is this, picky eater doesn't mean always a picky eater. Your child must be for a time being a picky eater. Let's introduce an interesting food in his or her diet. At this moment, your patience will work. Keep on trying a different cuisine in his diet. Does keto diet help with the leaky gut? Yes, it is. But for the leaky gut, you more shift to the probiotics. Sometimes keto diet is basically high protein diet. It is difficult to digest with the leaky gut. So if you switch for the fermented food, that will work like marvelous. Nothing can digest it, even dry grapes coming as it is in the stool. Make it if this happens now, to make all the things in a puree form. At least 50% of the food goes to the bloodstreams and 50% will excrete out. If you give in the solid form, it's quite difficult for the ingredients to out. Nutrients to out, I'm so sorry. Where do you buy this milk? This milk, I think so, you are asking for the camel milk. Go for, if it is readily available to you, take a pure one or powdered one will be good. Many of the companies are providing camel milk these days. Anything else anybody wants to ask me, you are free to ask. Okay, so bye-bye for now. Hopefully we'll meet again. And myself, Dietitian Rupali Gupta, work for all the parents for the counseling, for the diet of the kids. And it is really a great and really thankful to the Autism Connect who invites me. Thank you so much. Thank you. Okay, bye-bye. Take care. Have a great day.